This place is a dream. It's just absolutely amazing, the care that's given here.
It is so fun to see these patients and get them on these new game-changing therapies.
In this clinic, we have dramatic results.
Their weight's down, their blood pressure's down, their lipids are better, their A1C is better, but more importantly, they just feel better.
The Haverty approach is really very different because we've transformed the ways that care is delivered.
The concept of this cardiometabolic clinic is it's a multidisciplinary where it's a kind of a one-stop shop in under one house.
This approach is the approach that's making difference.
Type 2 diabetes and cardiovascular disease, and in particular heart failure, they're both the chicken and the egg. And by that, I mean patients with type 2 diabetes are much more likely to develop both coronary artery disease and congestive heart failure. But the converse is also true. So patients who have congestive heart failure are much more likely to develop type 2 diabetes. So these conditions and metabolic derangements are highly interrelated.
The traditional systems that we've used for a long time, where each specialist kind of takes care of their own organ system, where a cardiologist runs the heart, and endocrinologist runs the pancreas, and nephrologist runs the kidney, it's not very effective, and it's actually not very patient-centric because we all operate in our own silos.
We all had this drive to find a better way to deliver the care. So our approach early on was to put the patient in the center and bring in all the team members within the same practice with the same goal in mind, and really looking at the patient's cardiometabolic disease as one disease. And by taking that approach, we've really made inroads and seen a huge improvement in our outcomes.
They take all of the different doctors you have that are specialists, and then they take everything else that you're going through, and then they monitor and actually kind of scope a program for you.
We developed the team with a nurse navigator, a certified diabetes educator, which was a unique role to have in a cardiology clinic, pharmacists, nutritionists, preventative cardiologists, and really developed a cohesive team and meet and talk, and we call them our team huddles in the morning to talk about what we think our patients might need for the day so that we're all on the same page with the same goal in mind.
We do really rely on a guideline-directed medical therapy approach, and we strongly believe that's the right approach because these consensus of the experts that look at this and say you should try to get people on these therapies. And so there's these beneficial effects of the drugs we're using, but there's also the benefit of getting them off some of these older drugs like insulin, like secretagogues, insulin secretagogues like sulfonylureas, that when we can get them off that, it's like doubles the benefit. And they come back, they are dramatically better. I mean, they are happy campers. I mean, it's so gratifying.
My triglycerides have dropped drastically. My cholesterol is back down to normal levels. My ejection fraction, which basically is part of your health of your heart, has gotten stronger. Then also, I'm no longer having to wear compression socks every day, which is part of my congestive heart failure because of fluid retention. I don't need those anymore.
While our main goal is improving quality of care and outcomes for the patients, we also want to record what we do in a careful fashion and use that data not only to further improve the quality of care, but also to ask and answer important questions, advance our knowledge about diabetes care. So from the very beginning, we actually formed a registry where we record in great detail what happens with our clinical care. We summarize that knowledge by evaluating our data because we want to be a data-driven entity. And then we use that knowledge to make additional improvements. And what we can say for sure is that all of the key risk factors among the patients that we see improve quite rapidly and to a greater extent than comparator settings, both within our own healthcare system and nationally.
After we saw the results we were having at the Haverty Center, we very quickly realized that, we could help others do the same. And so we took our model and adapted it to be used across the country, and have now partnered with 6 sites that are members of the Cardiometabolic Center Alliance, and have a large number of centers that are interested. And the goal is to have at least 20 centers by 2022.
We are very pleased to be a strategic partner with the Cardiometabolic Center Alliance. In many ways, the Cardiometabolic Center Alliance reinforces and strengthens what Cinema is trying to accomplish in providing new paradigms of clinical care, bringing research innovation to patients with type 2 diabetes, and training future leaders who can take care of these complex patients.
Really being able to take this model and not only help my patients here locally, but help other nurses and other centers across the country apply the model and get that feedback from them as well, that they're starting to see these outcomes is really, really gratifying.
I don't think there is any better reward for physicians than to be able to see that what you do and how you transform care makes real impact.
You know, they're trusting us with their health and their future well-being, and to be able to change it dramatically with therapies like this is really, really a special thing to be part of.